Hi, good evening, everyone. My name is Chris. I'm the secretary for SCAN. This is our survivor sharing session. Today, the theme is on myths and truths about cancer. The reason why we have this type of survivor sharing is so that we can show those that are still on the journey. I'm sure some of you are. What it's like from the perspective of people who've been through the same journey. So we also want to share about cancer knowledge. So like I said, tonight we'll be talking about myths and truths of cancer. I'm sure every one of us, as long as we've been diagnosed, people tell us all the pantangs about that you should have while having cancer. What to eat, what not to eat, what to do, what not to do. So many things have been said by many people about cancer. A lot of it is said with good intentions. Some maybe not so good. So tonight, to help us filter out all these alternative facts, we have our special speaker for tonight. Dr. Adibah Ali is the breast and endocrine surgeon in the Sarawak General Hospital and in Timberland Hospital. She handles a lot of breast cancer cases, so is very familiar with all the myths that float around. So without further ado, here is Dr. Adibah to enlighten us on myths and truths of cancer. Dr. Adibah?
Hi, thank you, Chris. Good evening, everyone. It's actually, I was given 12 questions and it's quite tough to answer some of the questions. But as I go along, you can keep the questions till the end and you can ask me later about it. Okay? Right. The first question that I have received asking about, is it true that we need to detox our body thoroughly after the chemo? Okay. There's no evidence to suggest that the detoxing after and during chemotherapy is necessary. And sometimes we know that it would not be a safe thing to do during chemotherapy. Chemotherapy will leave the body naturally from the kidney, it can excrete through the kidney, liver metabolism, and there is no evidence that allowing a specific diet will help this alone. But that's why it's a very good advice to eat a good healthy diet. We have to take a good fluid intake, and we don't have to take so much amount of it, no need to take a large amount of it. And filtering water is a preference that many people take, but again, it is also not necessary. So it's actually about the first question, myth. Okay, so naturally the body, our own body can detoxify our systems each day. So tips are, you drink at least 8 to 10 cups of fluids per day to aid the digestion and bowel regularity. Eat at least 2 servings of citrus fruit a week, like apple, orange. The pulp and will add even more nutrients. You have to include the fruits such as apples, blueberries, and grapes, which these fruits naturally help eliminate toxic metals. Choose the fatty fish, nuts, and seeds that help reduce inflammation. And these foods are high in selenium to detox the body of mercury. Eat nuts, grains, beans, fruits, and vegetables, and all high in fiber and phosphorus to promote normal bowel function. Include the fermented foods like yogurt, tempeh, all these are high protein diet. Spice your food with ginger, hot pepper, and coriander, which may aid digestion and eliminate heavy metals. So actually, these are the normal food that you really take during your normal diet. So you don't actually really need to detoxify before the chemotherapy. Okay. So the second question that been asked is, how should we take care of ourselves as survivor? Of course, there is no single right way to heal, to feel better, to cope, or to change one's life. Spend one time learning about which ways of healing and feeling better are the best match for you. Of course, there is no perfect answers for this. Not everything is right and not everything is wrong. But there are some principles of healthier living that at the very least to help people to feel less ill. You just enjoy your life At their best, these principles may help improve your health, energy level, and overall sense of well-being. So what are the principles of healthier living style? Okay, so you make a lifestyle changes to healthier lifestyle changes, nutrition and dietary change, hydration, water intake, do exercise, meditation, and sexuality. So all these actually are self-care and recovery. So these are the things that encourage hydration and avoid the dehydration. Okay, so the hydration at least, it's not 4-5 is not enough, at least 6 to 8 glasses. Sorry, this is a typing error. At least about, usually you drink about 1.5 to 2 liter per day. Okay, herbal teas, non-fat soy milk, and diluted fruit juices. So avoid the drinks that causes dehydration, like alcohol, coffee and decaffeinated coffee, black tea, chocolate, high sodium or salty foods, caffeinated sodas. So this causes dehydration. So it is recommended that you get 20 minutes or 30 minutes of aerobic exercise at least 3 times a week. So example of aerobic exercise and normal thing like walking, jogging or running, cycling, swimming, or using at least a treadmill and other aerobic equipment. Or you can also do yoga, all right, part of meditation. Okay, so the activities are beneficial. They do not provide the total benefit of exercise and do not replace aerobic exercise. So these are example activities that you can always do every day. You can walk the dog, you can do golfing, gardening or yard work, housework, running around at work, at home or after your children. So, you can do mindful meditation. Okay, meditation is about rediscovering the present moment. When we slow down our normal activities enough to notice what is actually present, we find that gradually some kind of space opens up inside us. So this space allows for awareness and perspective, both of which help with accepting the challenges of life. So the other question that I have received is chemotherapy worse than the cancer itself? Okay, of course, it's a myth. So what is chemotherapy? I think most of you have gone through this. So chemotherapy is a drug treatment that uses powerful chemicals to kill fast-growing cells in your body. So you need to have a very powerful drug to kill these cancer cells. So chemotherapy is most often used to treat cancer, since cancer cells grow and multiply much more quickly than most cells in the body. So this chemotherapy helps to suppress the cancer cells to grow. So what are the side effects? Depend on the drugs, depends on the individual. I can see my patients, usually they can go holiday in between the chemotherapy cycle. So not everyone have the same effect. Some of them have immediate effect after they receive the chemotherapy. Some of them may have a week after that. But whether this is harm or not, usually clinicians will closely monitor for harmful effects. We do the routine blood test before the chemo. So if they feel that it is not safe to start the chemotherapy in this patient, usually they will withhold the chemo until it is safe to be started. And then we will perform echo for certain chemo to see the heart function. And we won't start if patient does not fit for chemotherapy. And of course, we will discontinue if we found that it is harm more than benefit. But if you don't take chemotherapy, cancer will grow. So if it's not treated, this will lead to death. So of course, if the question is asked whether chemotherapy is harmful than chemo, definitely say that chemotherapy is, of course, cancer is more harmful than the chemotherapy. The next question, do biopsies cause cancer cells to spread? And then the first before that is a myth. It does not cause biopsy, does not cause spread of the cancer. Why do we need biopsy? This is, we need the confirmation before the removing part of your body. Like a breast, you have the breast lump. Of course, you need to take the biopsy. I can't remove a patient's breast without the biopsy. So we need to confirm it whether this is cancer or not. Biopsies offer very valuable information that allow us to tailor treatment, because in some cases, we can offer chemotherapy and radiation before the surgery for a better outcome. For example, like colon cancer, breast cancer, or locally advanced cancer. Usually we need the biopsy because we need to do the chemotherapy first before the surgery. So this is the paper, okay, to support that. They have done in 2,000 patients, have dispelled the myth that cancer biopsies cause cancer to spread. So they've shown that patients who receive a biopsy had a better outcome and longer survival than patients who did not have a biopsy. Number 5, drinking soursop tea leaves help destroy cancer cells. It's a myth, okay? Graviola or soursop is the fruit from trees in the rainforest. The claims that Graviola can treat cancers are not backed up by research, okay? We did not do any proper randomized control trial to compare those patients who have cancer, whether they took Graviola and they did not take Graviola. So for us clinicians to have a proper evidence, we need a proper sample study, a good study design to show that whether this Graviola is actually works or not. It can cause nerve damage, leading to symptoms that are similar to Parkinson's disease. Many promotes Graviola as a cure of cancer. But as I said, there's no scientific paper, cancer organizations support any of these claims. In laboratory studies, Graviola extracts can kill some type of liver and breast cancer cells. So this is actually in the lab studies. And these cells are resistant to some chemotherapy drugs. A more recent study showed that Graviola pulp extract has an effect in mice, but there have not been any studies in humans. So we don't know whether it can work as a cancer treatment or not. Okay, so this is the paper that they have shown, they have checked on whether these anti-cancer properties of Graviola. But as I can see, this is only a clinical case report. So to describe the 66-year-old female diagnosed with metastatic breast cancer, whose metastasis had progressed even after multiple rounds of chemotherapy, including anthracycline and taxanes. So the patient self-medicated by boiling 10 to 12 dry leaves for 5 to 7 minutes, then orally consume an 8 ounce. So it was reported that her meds remained stable for 5 years on Graviola. But again, as what I have seen, this is only a clinical case report. It has not been tested for other patients. Then for us to support the statement saying that Graviola helps, you need to have like thousands of subjects, patients, to whether this is really works or not. So it's still a myth for now. So the next question, is it true that cancer is genetic? Okay. True, but it's only 5 to 10% of cancers are genetic. So cancer, they can be sporadic. Sporadic means not associated with genetic link. And it can be genetic familial, 5 to 10% associated with genetic variant. So sporadic means that it's not associated with any genetic link. Okay. For example, in breast cancer, as you all know, BRCA1 and BRCA2 is one of the example of the familial breast cancer, but this is only 5 to 10%. The rest of breast cancer are more to sporadic, which patient does not have any family history. Thyroid cancer like KRAS mutation. Colon cancer is APC gene mutation. So these are the gene mutation in cancer listed. So how do we know if these cancers are associated with genetic link? Usually they occur at young age, less than 30 years old or less than 40 years old. So like breast cancer or colon cancer presented, you know that most common age is between 40 to 60 years old. So if it is less than 30 years old, usually considered as genetic link. Okay, more than 2 first-degree relatives have history of cancer. Okay, for example, if we ask the family history whether this patient had breast cancer or not, we ask the family, so they will say that, okay, I have 2 siblings who have history of breast cancer, or have like 3 or 4 related, my cousins are having the same cancer. So we can say that they are genetic linked. And in breast cancer, for example, I always talk about the breast cancer because it's my area. So triple negative hormonal breast cancer, this is one type of aggressive breast cancer. So this is usually associated with genetic. And in colon cancer, like patient had history of multiple polyps in colon, more than 100, like familial adenomatous polyposis, which risk factor of having the colon cancer. These are genetic link. Question number 7. Sugary foods and drinks are among the root cause for cancer illnesses. So is it these myths or facts? So it's myth, okay? All cells depend on sugar to grow, particularly glucose. At this point, it has not been shown that by eliminating dietary sources of sugar and carbohydrate actually results in slower growth of tumor. The truth is that our bodies, they don't get to pick and choose which cells get what fuel. In fact, if you avoid all the sources of sugar, results in your body have to work extra hard to make the glucose that it needs to function. So you can't live, and you can't just live by eating. You cannot live sugar, right? Yes, you can take sugar, but in the moderate amount. You don't take excessive amount. There's no evidence saying that if you take sugar, you are feeding the breast cancer. Many people have heard the statement that sugar feeds cancer. Maybe your friend, family member, or a well-intentioned but somewhat misguided health professional has even said it. The fact is that all cells, including cancer cells, need sugar in the form of glucose to generate energy. So our body is not like cancer cells. Our body, you need some type of glucose to generate energy to help us to go against cancer cells. Carbohydrates and sugars are an important part of healthy diets. So there are 2 basic forms of sugar. Either added sugars are simple sugar that we add to our foods like coffee or tea, or they are added to processed and prepared foods by food manufacturers. And naturally occurring sugars as the sugars that are found in whole unprocessed food, such as milk, fruits, vegetables, and grains. So they are usually called complex carbohydrates. So the bottom line, sugar comes from all carbohydrate foods, so we can't control which cells get the sugar. If we don't provide our body with enough carbohydrates through food, our bodies are forced to make it in order to meet the needs of the cells. So making sugar results in muscle loss and a weakened immune system, which is the last thing you want during the treatment. Therefore, whenever possible, it is the best to provide food sources of carbohydrates regularly throughout the day. Okay, I don't say that you need to take large amount, but you have to take according to your requirement. So for those who are having trouble finding things to eat, don't feel like eating, or are losing weight quickly, ask your doctor or oncologist statistician for strategies on getting adequate nutrition. So for those not having trouble tolerating foods, eat a diet at least 2/3 plant-based foods, and keep animal sources to 1/3. So this, you see this diagram, okay, you can have a plate, this example for a plate. So you need to include the vegetables, whole grains, fruits, healthy protein, and comes with the water and healthy oils. So this is for the recommended. If you want to take the lower dietary fat, between 10 to 20% of calories, you can take low or non-fat foods. You can eat more plant-based protein and eat less animal-based protein. You can take more beans and soy. less turkey and lean meats. Minimum daily servings of grains 6 per day, vegetables 3 to 5 per day, fruits 2 to 4 per day. Okay, so like whole grains, you can take it by whole grains, tofu and soy milk. Drink at, I think you have a talk with, I think, dietitian or nutrition about this healthy diet. Okay. So the next question, which is very interesting, can exercise like jogging help prevent cancer? Okay. So it is true. Studies have shown that if a person has a BMI more than 25, it has an increased risk to all the cancers, not only breast cancer, with higher death rate. So small waist and waist hip ratio give a significant protection premenopausal. So even in the breast cancer, you can see low risk, moderate risk, and high risk. For low risk, obesity is one of the risks of patients can cause breast cancer. So why obesity increase risk? Okay, fat cells produce estrogen. So if extra fat, it produce more estrogen. As you know, most estrogens will increase hormone receptor positive in breast cancer. So patient tendency to have the breast cancer. Okay. So there are few studies have shown that first is obesity as a major risk factor for cancer. So in this study have shown that weight loss lowered breast cancer risk. Okay. BMI with overall survival. Okay, this is a study of body mass index and survival in women with breast cancer. It's a systemic literature review and meta-analysis, means that they have collected 82 follow-up studies, and they have analyzed all these studies, and it is showed that obesity is associated with poorer overall and breast cancer. Okay, so let's work out. Okay, the next one, they have another study, physical exercise and reduced risk of breast cancer in young women. Okay, so next question is it true that we cannot be under the hot sun after chemotherapy and radiotherapy? It's true. Okay, certain forms of chemotherapy can make patients more sensitive to the sun, leading to skin reaction, tanning, and burning. So a classic example is 5-fluorouracil. So if you have undergone radiation, know the boundaries where you are exposed. Means you don't actually, if you do radiation on the breast, you have covered your breast area with the cloth, so it does not matter. This is, we are talking that we do not go under the sun for the area that exposed by radiation, because this area will be the most sensitive to sunburn, especially during the first year after treatment. So how to avoid? You can always wear the sunscreen. If you're exposed to it, means I think these questions mostly asked by the Caucasian, asked by the Western whites, for the whites, because they like to sunbathing, they like during the summer. So this and then wear bikinis. So that's where these issues come out, whether can they expose themselves under the sun after the radiation. So I don't think we have problem much here because we are covered. Okay, so if you need to expose it, then we need to wear the sunscreen, protect the head, dress for sun protection. So how long, patient may ask how long it will be sensitive. Usually it can be up to 2 months post-chemo, up to 1 year post-radiation. Okay, the next one. It is said that smoking may cause cancer. If it is true, why then that my friends who are smokers are healthy and myself, a non-smoker, non-drinker, has cancer? So that's why. How is smoking related to cancer? This is, yes, true. It is said smoking may cause cancer. How is smoking related to cancer? Smoking can cause cancer and then block your body from fighting it. So it will weaken the body's immune system, making it harder to kill the cancer cells. When this happens, the cancer cells keep growing without being stopped. So it is more resistant if patient is smoking. Poisons in tobacco smoke can damage or change a cell's DNA. So when DNA is damaged, a cell can begin growing out of control and create a cancer tumor. So I can't say that if you are not smoking, you definitely protected yourself from the cancer, because there are other cause of cancer. It's not not only smoking. Like let's say, I can always say, okay, breast cancer. Patients have estrogen, patients are female. As long as you have breast, you have risk of cancer, and you have the hormone like, estrogen. Like colon cancer, you have other causes, risk factor that causes the cancer. It's not only smoking. Okay, so but what it means that if the patient is a smoker, they have risk of cancer compared to the non-smoker. So for example, in UK, 7 out of 10 lung cancers are caused by smokers. So when they studied this, 80% of lung cancer deaths are related to smoker. This is more like in the study when they compare between the smokers and the non-smoker. It does not mean that non-smokers do not have the problem. They do, but there will be less number compared to the smokers. So they have studied shown that smoker also have risk factor for cancers other than the lung, can cause mouth, larynx, pharynx, esophagus, kidney, cervix, liver, bladder, pancreas, stomach, colon or rectum, and myeloid leukemia. So this is a study. This study with the topic of impact of tobacco smoking on the risk of developing 25 different cancers in the UK. Okay, so these results show that smoking was further found to be positively associated with several cancers such as liver cancer, bladder and kidney cancer, pancreas and lymphoma. By contrast, the use of tobacco was negatively associated with the risk of developing skin cancer, prostate cancer, multiple myeloma, endometrial carcinoma, or breast cancer. Okay, there are 12 questions so far. I've answered 10. So far for the first 10 questions,
okay.
all clear about? Yeah.
Yeah, thank you, Dr. Adibah. Yeah, there were 2 other questions. The first one was non-traditional treatments. How effective are they? Does it do more harm than good? I think what they meant with this question was a bit unclear. It's with alternative treatments. And I suppose a majority of people do not understand how cancer research is done, how proper studies are done, and the various stages, especially like you said, from on cancer cells, then moving to animal studies before moving to human studies.
Yep.
I know for a fact that a lot of things that gets reported in the papers sometimes are only at cellular level or
testimonials.
Yeah, or
most of them they have been
either testimonials or those that only up to animal testing stage, and we are not mice. So yeah, you like to comment on this?
Okay. For that, whether this is again, whether this is harmful. Let me see the patients. Okay, the question: non-traditional heart treatments, how effective are they? Does one risk more harm than good? This is what actually the patients usually ask me, whether they can take this or not during the treatment, whether they can take or not. Usually I said that I've told them it's up to you. I don't advise. Sometimes they have spent so much money on that without knowing that whether this is really useful or not. It's more like psychological thinking, whether psychological, if they're taking this makes them feel better. Okay, I don't stop them, but then there are certain alternative treatment we do not know the content. certain content, it can cause resistance of chemotherapy, means that it can interact with the chemotherapy, which causes this chemotherapy will less effect. They don't give so much, they didn't actually effect well on the cancer cells. So that's why I've told them is like, try not to take anything while you are on treatment, okay? But it's the best that you can take natural diet, which is healthy, which is already whatever things in your natural diet is good enough. Because some of them have spent thousands and thousands, thousands of money just for this supplement, which you do not know whether this is really help or not. Yeah, I have one patient which like we have few incidents. My post breast surgery, mastectomy, removal of the breast, came with bleeding, post-op bleeding. So with this, all these subsequent 3 patients, when we ask, they have taken the same alternative treatment. So you do not know the component, whether this cause, anticoagulation, means that they have the components that prevents the blood to be clotted. So that's why that's why we cannot blame whether this agent can cause do not help to stop prevent coagulation, but that what we have assumed, because you don't know the component. So try not to take and spend so much money on those things. But if you think that this help your psychological effect, patients feel makes better, we don't actually stop them from taking it, but it is your risk, on your own risk. Yeah. Is it clear?
Yeah, I think it's clear.
Yeah.
The final question is actually, so this is a bit more of a controversial thing. It says cancer cures are being withheld. Drug companies, the government, and the medical establishment are hiding the cure for cancer. Is this true? This is a conspiracy theory.
Yes, yes, yes. It is the same like when people ask that, like a virus created so that antibiotic can be produced. So this makes the
Yeah,
company to be more rich, right?
yeah.
It's the same. Yeah, it's a same conspiracy. But what what I know that a lot of research and studies have been done just because of they want to try to find a way that this cancer are cured. Let's say for patients who have, my breast cancer, the aim of when you say that curative intent means that we want to cure them 100%. So we don't want them to recur. We don't want them to, recur and progress as metastatic or spread to other organs. Even like they think that, okay, for a cancer, they have 2 types of treatment. For early stage of cancer, any cancer, we call as curative intent. Means that we want to 100% to cure the cancer. Okay, whether this is form of surgery, radiotherapy, or chemotherapy. Okay, so for chemotherapy, all these 3 treatments have different function. Okay, surgery is you want to have a removal local cancer. Chemo is you want to inject your medication through the system, your venous system, so that it will kill the cell cancer in your bloodstream in order to prevent it to spread to other organs. So this is what we call curative intention. So the second type of treatment is for metastatic disease, means that it has stage 4 disease. So palliative means that you don't aim to cure, but you want to stable the disease so that the disease won't progress as fast. Because last time we can say that, okay, stage 4 breast cancer is a death penalty. You have the time 3 to 6 months. But now no more. We do not tell the patient those words anymore, because in this type of treatment, we call it palliative. We want the patients to live as long as they like, I mean, as long as what they treat chemotherapy can help them to stable the disease, means that so that whatever medication, whatever cancer cells that present, it does not grow, it has stable. And then what we can see that these patients can live more than 5 years, which is very unlikely in previous years. Okay, so if we say that this drug company have, do not aim as do not are hiding the cure of cancer, definitely it is not true, because we can see the evolving of the cancer treatment from previous years until this years. A lot of patients can live longer as expected as before. Yeah.
Yes, that's very true. Especially if you look back at about 100 years ago, how were they treating cancer back then? There was no chemo, right? Chemo wasn't found until after 1950s.
Mm-hmm.
And I think they were also doing very massive breast surgeries with very huge margins.
Yep.
Yep, cutting all the way until
Yep.
the shoulder, something like that.
Yeah, correct.
But we definitely have advanced. I mean, you only need to think, how much money can they be making if they have to pay off all the doctors, all the nurses, all these people in the world to.
Yeah, the
It
aim
doesn't make sense.
now is not like the treating the cancer at only. We want to have the patient's best quality of life.
Yeah.
We want to have the surgery. Now surgery, they are helping us to make the surgery is less and less now, more conservative now. Okay, so like last time we don't have usage of chemotherapy to shrink the tumor. No, now we are, the surgeons like, okay, now sometimes some of the patients I will send them for chemo first. So to help me, instead of doing the mastectomy, after chemotherapy, I can perform breast conserving surgery. I don't have to remove the whole breast. Okay, so this is what we have said, that this drug has been doing a lot of research to help us to have less surgery and of course have better quality of life in patients.
Yeah.
Mm.
Okay. Thank you, Dr. Adibah. Let's open the questions to the floor. So if you guys want to ask any questions, just unmute yourself and ask away. There's only a few of us, so we can do this. Anyone? Madam Bong, you have any question?
No, I had just undergo the second chemo and I find it very difficult, suffering. Yeah.
Yeah, I understand. I know it's like
Not easy to go through chemo.
Yeah,
Yeah, but thanks, Miss Adibah, very much. Thank you.
welcome. Yeah.
Any questions, Des? You have any questions? Robert?
Not so much relating to myths and truths, but I was wondering, like, my cancer, it's a proliferating tricholamel tumor, which is very rare.
Yeah.
I was wondering if like, since it's so rare, right? Would I be, if I wanted to volunteer to be studied on, is it too late now, or how to go about it? To try and contribute to the knowledge pool of the cancer that I have.
May I know who's your clinician? Who are you with?
I just had surgical removal of the cancer. So
Okay.
I'm not actually seeing anybody.
Okay.
I did not have any radio or chemo as well. So it was
Because
just
frankly speaking, I'm not familiar of the one that the one that you're having now. I'm not the best person to ask, but if you can actually ask your clinician, your doctors, your surgeon, or your the one that treating you, she might be the best person to answer whether you can join and participate in the like in all this study or not. She would know better. If you ask me about breast cancer, then I definitely can can tell you more about it.
For Robert's case, since I know a bit about it, it is quite a rare cancer, and I
Yeah.
believe he was successfully treated using surgery only. There was no need for chemo or
It's a soft
radio.
tissue. There are certain cancers which are not sensitive
It
to
was a
chemo,
scalp,
especially soft tissue tumor.
scalp cancer, I believe, cancer of the scalp. So yeah. So to answer your question, Robert, I think you were past the stage that you can go for a clinical trial, since you're technically not, you're already in remission. But your case would be
Yeah, not all
good.
cancers are chemo sensitive. Chemo and radio sensitive. If for those cancer who are not chemo sensitive, it's the best treated by surgery. Usually trials actually involve more on cancers who need chemo and radiotherapy.
Yeah.
Thank you.
All right.
Any other questions? I have one. It is slightly to do with the sugar one. There have been a lot of people going on keto diet, trying to get into ketosis to reduce the risk of cancer. I wouldn't say cure cancer, but what are your thoughts on ketosis?
Keto diet means that something that they reduce the
They will reduce the amount of sugar and carbs
amount of sugar and carbs, right?
to
I
about,
know it's more like those who wanted to take on diet and reduce. It's a
yeah. But
program.
it has been touted as something for cancer. I know one of my friend, MBC patient that passed away. She did put herself through through this keto diet during treatment, which I was pretty much against last.
I know.
But yeah, but
I know. I've seen few of my few. It's not my patient. Few of the my the one that I know, my friend, they also put themselves on keto diet, which I advise not to, and they actually spend so much to see this dietitian. I mean, it's not nutritionist. It's what to say. They have advisor to tell them not to take. There are certain foods they need to take, and instead of taking this thing, they have replaced with other things.
Yeah.
Spend so much on that. That because in their mind they have been primed saying that when you feed sugar and carbohydrate, you are feeding the cancer cells.
Yeah.
Again, as what we said that like if you take sugar and carbohydrate, your body, you cannot choose which cells they can feed. Whether okay, this sugar can feed cancer cells, this sugar cannot feed there's no way that the
I think
body
one of
can choose.
the reasons why this myth came about is because of PET scans. Because you use FDG.
Yeah.
So they're saying, oh, you use glucose to find the cancerous cells. So yeah,
Yeah, that is only to detect, but it does not actually feed the cancer cells.
yeah, that's the thing, because that's how myths get started.
Yeah, that's why for us to support this theory, we need a really, like a proper research study. Like there's no paper at all supporting this evidence. You need like thousands of patients, and you have to have a lot of, to one drug or chemo drug be accepted. You need to test on a lot of participants.
Yeah, plus it's a dietary research which tends to be much more difficult, because how do you control a person's diet when you're doing in a study?
Yes, you need the body. You need the normal cells to be strong enough to go against cancer cells, and to for you to withstand the chemotherapy. Even Madam Bong also told that, it's very suffering when you undergo chemotherapy. You just imagine if you are on diet, how can your
Yeah,
body strong enough to withstand the chemotherapies?
yeah,
And I've told them, you enjoy your food. Like you have been told that like you are suffering, but you wanted to restrict yourself from taking the diet. It is not unfair to you and your own body.
exactly. I think there was a Dr. Lau Li Gong from GMC.
Uh-huh.
He gave a talk once, and he said there was this patient of his, young boy,
Yeah.
and then he wanted to eat KFC, but the mother won't allow. There's no appetite for anything else. He said, "You want KFC? Give him KFC, lah. As long as
Yeah
it's
lah.
not."
Yes.
Right.
Yeah. And there's one point that when you have a lot, like certain cancers, like breast cancer does not affect much. Like the gastric cancer, colon cancer, you don't have appetite to eat, so you can't eat it. So it means like if you have appetite, you don't have any problem in your appetite. So why do you have to stop yourself from enjoying the food? Just take your food. But of course, you have to take in moderate amount. You don't take.
Moderate.
Yeah,
Moderate.
definitely moderate.
Yeah.
How much is moderate?
Because not enough blood later on. White blood cell, red blood cell, not enough.
Yeah, because that's why I do normally ask people to at least take some protein, some form of
Yeah.
protein during when
Yes.
they do chemo. Because I've
Yes.
seen some that go on a very vegetarian diet, no meat, nothing, not even tofu, soy meat, so very little protein. Then
Yes.
it's
Protein
great,
is really need to generate the new cells. If like, especially if you have a hair loss, if you don't have any scale, skin scale, if you don't take protein, how does your new cells can generate new cells?
Protein. What are protein?
Like it's just like you're having with your workout, right? You have muscle loss and loss of injury. I mean, your muscle injury during workout. They are encouraged to take protein to replace the protein while they lost during the workout. So this when you have a cancer treatment, you are in anabolic state, means that they take out so much body protein from your body. So you need to replace that. If your body is in anabolic state, anabolic means that it's negative. Like negative. It's like it's taken negative. It's taken more than what you eat. So it is actually not good for your body, your immune system.
okay. Any other questions before I let Dr. Adibah go? You still
Hi,
continue?
Dr. Adibah.
Hi.
Hi. I would like to know what are the chances of a recurrence if a patient does not go for chemo or radiotherapy after mastectomy?
Okay. I always tell my patients, these three treatments have different role. Surgery, I can only remove the cancer cells that I can see. Okay, radiation therapy is the one that I can't see locally. So chemotherapy is the one that you put the drug in your blood vessels to prevent the cancer develop in other sites or other than the breast. So if you are taking only surgery without radiation and chemotherapy, you know that you are actually taking about 50% of the treatment. I'm talking about the cancer which need all three. There are certain cancer, early breast cancer, you don't need the chemotherapy. Okay, how do we decide patient on chemotherapy is the one that you know that when we say that our aim of treatment is not only to treat the patient. Okay, it's not only to treat the patient. We want to prevent the cancer to come back in future. So what I can see is what I can remove is the thing that I can only see. But you don't know the cancer cells is already present in your bloodstream. So when you look at the the sample biopsy that came back after the post mastectomy specimen, so this cancer may have a very aggressive that potentially can cause recurrent in future. That is why you need to complete your treatment with therapy or radiotherapy. You understand?
No, like, what happens if the oncologist does not recommend chemo or radiotherapy, just hormone therapy after mastectomy?
That's why when they look at the specimen, they will see whether what's the grading, the cells that inside your report. If they say that these cancer cells is do not have potential to recur, so it means that your chemo can cause harm. It means that they do not want to overtreat the cancer. Okay, so they won't give chemotherapy. If they know that this cancer is potentially can recur in 5 years by through this specimen, so they will advise you on chemotherapy. So that's why not all the patients need chemotherapy. Early breast cancer, if you give, you are actually over-treating because we are treating the patient based on the study, like they were saying that, okay, early breast cancer, stage 1, okay? Stage 1A, 1B. You know that recurrent will be nil. So there's no point of getting the chemotherapy.
What about radiotherapy?
Radiotherapy depends on the type of surgery that you receive. Let's say you choose, mastectomy, you have removed the whole breast tissue. So you don't need the breast, you don't need the radiation because you have removed, unless the tumor is large, more than 5 centimeter. So you know that recurrent rate is high, so they will give you radiotherapy. If the patient is opted for the small white local excision, means only removing only that part of tumor. So you need the radiotherapy because you are not removing the other breast the breast tissue. So the recurrent rate is high. That's why we will advise for radiotherapy after breast conserving surgery, after you remove only that excision, white local excision. So it's actually for us to decide whether you need chemo. Personalized. Not all patients receive the same treatment. It is individualized. We see the risk based on the research study, then we'll decide. And we cannot decide when the patient comes at the first place. We can only decide after your mastectomy or sample, the whole specimen comes out. That's where we can decide.
Is that clearer for you?
Oh, another thing, when it comes to hormone therapy, I understand that there are two types. One type is for premenopausal women, and the other one is for postmenopausal women. And I understand that tamoxifen is usually for premenopause, right? Tamoxifen.
Yep.
But I also know of cancer patients who are given tamoxifen even though they are already postmenopause.
No, they depends also. First, they see the risk. They say the risk is higher of having recurrent. They will give aromatase inhibitor, and then they will see, because aromatase inhibitor, it is good in the sense that it's can reduce the local recurrent, but it has effect more on the bone. That's why when you are on the aromatase anastrozole aromatase inhibitor, you know that you need to go for the bone scan, right, to check whether you have your. Some patient may not tolerate aromatase inhibitor as good as tamoxifen. So they will see. That's why I'm telling you, it is a personalized treatment. Not all patients are treated the same.
Oh. So that means postmenopausal women can also take tamoxifen.
Can, yes.
What about the other way around?
Aromatase inhibitors are more expensive than tamoxifen. So those who are offered this aromatase inhibitor, if those patients are not can tolerate to chemotherapy, okay, if they know that they not tolerate to chemotherapy in elderly age, so usually we promote this aromatase inhibitor rather than tamoxifen.
Which is better, actually, letrozole or tamoxifen?
Which one is more expensive or better?
Letrozole. I mean, which is more effective to treat the cancer?
Both are equally effective. That's why they will see what type of breast cancer you have. They will see whether did you undergo any chemotherapy before. There are a lot of things. It's equally effective, but of course, this letrozole is more effective than tamoxifen. But not all patients can take. And it is more expensive also lah. That's why we have to be very selected. The criteria are very selected. If you are in private, they will give letrozole more.
Oh, okay.
Des, you have a question? You want to ask it out? Des?
Yeah. I'm running out of battery. Wait.
Des, do you want to ask your question? Wait for doctor to check.
Walking in the dark. Any more questions?
Yes, there's one from Des. He typed it up, but I think he can just ask, right?
Yeah. What's the question?
I put it in the chat. So my question is, why is cancer more aggressive in
Okay. As what I said, is usually it's more to genetic link. I can't answer why is it, but apparently, you know, the commonest cancer usually occurs at 40 to 60 years. So why? But if specifically in my breast cancer, those patients are less than 40 years old. Usually they are triple negative or HER2 positive type breast cancer. They're not hormone positive, they're hormone negative.
Okay.
So these patients, this group of patients, they are more aggressive. And then if we give, and we do treat surgery alone, they might have recur in future because they have longer lifespan as well. So that's why we are quite aggressive in treating those group of patients.
Does that answer your question, Des?
Yes.
Yeah. It's not really clear. I cannot tell how.
Yeah.
But
I'm just curious, do those who are younger, they suffer the chemo side effects worse than those who are older?
No, it's the same. I mean, I have different group of patients where some of them, they may have effect, not much effect as, it does not actually depend on the age. I don't know why certain patients have less side effects. I have this and which I said earlier, they can go for holiday, and then my patient will say that they have the side effects immediately after they receive one, and then some patients they may not have the effect until a week after. So yeah, and then some patients they said that they don't feel anything. So this group of people are really lucky to have not to have the side effects.
Yeah, those are the lucky ones.
Yeah.
I remember my friend's mom telling me that because she's so much older than me, she said after the chemo she was able to go shopping, go jalan-jalan. I said, wow. I said, Auntie, you're so hebat. I am back home and I'm lying flat on the bed.
Yeah, but
Yeah.
one of the reason is elderly people, they don't get the full dose of treatment.
Oh, okay.
Either the full dose of treatment or they put in the divided doses. It's like, let's say the younger patient received like say 100 gram. So older women, they divide the doses in 3 divided doses. They don't give blown of medication. That's a reason, because they know that the old elderly, they cannot cope with the high dose treatment.
Right. Okay. Oh, that's good.
Can I share?
Yeah. Datin, is it?
Yes. Just pop in because I was late. Yeah, talking about side effect, my girlfriend got it earlier than me, and she was flat. And I can remember that I had to nurse her. I had to put buckets and buckets around her because she was vomiting all the time. Yeah. So by the time I got it, after my chemo, I also put basin, buckets, water, thinking that I will vomit. But I did not even vomit once. I was tired for maybe 1 or 2 days, and I traveled the world. I went to South Africa, I went to Niagara Falls, I went to Switzerland in between my chemo. So I suppose everybody's a bit different, but I was never lucky because I got a lot of complication, but it did not deter me. Through the breast cancer alone, I have 5 surgeries. So I'm always so envious that people go for operation and do your chemo, and then side effect, yeah, but then, not many people go through like me, go in and out. And Dr. Adibah has seen my open wounds for 10 months. I was nursing the 10 months of open wounds. So I suppose we are all different.
Yeah, we are all different.
We are all different. Well, we are lucky to be here and sharing. But I have one question. A friend of mine had her CA breast like when she was in her 30s as well. And she decided to have a double mastectomy. But like 4 years ago, she now lives in New Zealand. And 4 years ago, they decided that it's probably good for her to have another round of Tamoxifen. So because they feel that maybe longer is better, I don't know. So I was a bit like, should I do this as well? What is the reason?
Actually, there are. I mean, during your era, Datin, there's fixed that they're saying that 5 years tamoxifen is enough. But now actually there are few studies that they have comparing giving 5 years and up to 10 years of tamoxifen. So that's why your friend is offered for second cycle of tamoxifen for another 5 years. But this for 10 years is the one that those group like they have higher risk, they have selected the criteria. This patient have recurrent rate is higher. So if recurrent rate, it does not mean that only you have 2 mastectomy done. She has 2 breasts removed, but doesn't mean that the recurrent is occurs at the breast only. It can recur in your bloodstream at the lung. This is the one that when they know this patient had potentially can recur in other sites, so they have identified this group of patient, and this group of patient benefits of 10 years tamoxifen better.
Mm-hmm.
I have a patient that, I think there are some of you have they have breast cancer removed, and then yearly mammogram and surveillance saying that it is totally no recurrent on the breast. But most people, they will come with current at other sites, like lung, liver, without being noticed earlier. So this is the one that we know that chemotherapy is needed. That is why those patients with hormonal positive, we need to start them on hormonal, because we do not want them to recur in 5 to 10 years.
Mm-hmm.
That they aim for 5 years recurrent free, but now we want to aim that 10 years above recurrent free. But for us, 5 years is not enough. They have to live more than that with cancer free.
Mm-hmm. Yeah, she got hers when she was maybe like death age.
Yeah.
And she started taking it back. She's just 1 year younger than me. So she took it back again when she was about 58.
Yeah.
You know, yeah. But I didn't take tamoxifen because I was already premenopausal when I had mine. So I was on letrozole. Yeah. Okay, thank you.
All right.
Thank you.
Okay, we shall let Dr. Adibah go now before we continue on with our own sharing.
Okay.
So
All right.
give a big thanks to Dr. Adibah.
All right. Thanks. Okay. Thanks to have you all around. Okay.
Thank you for your talk.
Thank you.
I'll stop the recording.